Exercise Intervention Program. The subject that participated in the trial was a 24-year-old male weighing 82 kilos and standing at 178 centimetres. He presented with no pre-existing injuries or health concerns as per the ESSA pre-screening tool and was a non-smoker. His occupation involves majority of sedentary work as he is a logistics manager and spending lots of time behind a computer. He has also not participated in any prior scheduled training. After the initial 2-week trial was undertaken, it was observed that the individual did not meet the recommended weekly exercise guidelines as per the Department of Health Australia and Brown, Borman, Bull and Burton. These results warranted the creation of an exercise intervention program to ensure that the subject does not develop lifestyle diseases that can come from inactivity. Due to the subject's age, they are most at risk of developing lifestyle diseases such as cardiovascular disease, high blood pressure, type 2 diabetes, and obesity. If the subject were to also have any mental health issues, inactivity would not promote quicker recovery. Obesity is a rising epidemic in Australia, with over half the population classified as obese or overweight. This is due to a lack of physical activity and poor lifestyle choices. Obesity is a risk factor for nearly all lifestyle diseases and therefore should be corrected through appropriate physical activity. A study conducted by Liu and colleagues showed that if young adults participated in appropriate physical activity, they were less likely to develop cardiovascular disease later in life. For the subject's age, a serious concern for the development of CVD is excessive alcohol consumption, which surrounds majority of social events for young adults. Also, living busy lifestyles trying to balance socialising, schooling, and work can lead to little time or little energy to participate in physical activity. These factors can contribute to the development of high blood pressure, heightened lipid levels, and excessive weight gain. Young adult males that may suffer from mental health issues are also more likely to turn to binge drinking and substance abuse as a form of medication, rather than seeking professional help. As mentioned, excessive alcohol consumption is a risk factor for CVD and should be avoided. Exercise has been shown to release endorphins in the body that can heighten mood and improve the stress response to external stimuluses. Exercise as a whole has the ability to limit many risk factors for lifestyle disease, such as those mentioned. It can also improve overall cardiovascular function and the amount of body fat which an individual holds. The stages of motivational readiness is a 6-stage model that has been described as one of the most influential models on health behaviour change. It has a focus on internal manipulation and encourages behaviour change through self-efficacy and decision-making. It has been observed that the stages of motivational readiness provide the most promising outcomes when applied to individually tailored programs. The individual currently falls in the preparation stage of the model, with understanding that there is an issue and taking action to promote change. The aim of the model is to move the individual through the maintenance stage, where behavioural change is sustained. Gordon and colleagues conducted a study on the stages of motivational readiness model and the behaviour change that it can cause. As shown in the figure, as the intention increases, so does the behaviour change of the individual. For the training intervention, the individual requested to include exercises outside such as walking and jogging, as well as utilising the local gym that he is a member of. Throughout the program, training principles are applied to ensure that the individual obtains maximal benefits and results. Different types of training are included into the program to ensure a holistic approach to physical activity. With the inclusion of both resistance and aerobic exercises, the individual is also then able to gain different benefits for overall health, including those listed above. As shown throughout the duration of the program, the sessions progress to ensure that the participant does not plateau or obtain minimal results as they improve in strength and ability. Change in behaviour can be observed from the initiation of the program, where minimal volume and intensity can be observed, through to the final week, where training volume and intensity have increased dramatically. Throughout the exercise program, the aim is to move the client from the preparation stage into the action stage. As they continue their behaviour change, they should aim eventually to move into the maintenance stage, where new behaviour becomes habit and is ultimately sustained. As shown at the conclusion of the exercise program, the individual has met the recommended weekly exercise minutes with a total of 80 minutes of vigorous exercise and the inclusion of 2 strength-based sessions.